Welcome to Shriners Hospital. I'm Sarah, one of the nurses here. And these are some kids who've had surgery at Shriners, just like you.
I'm Katie, and I had surgeries on my leg.
I'm Aaliyah, and I've had 4 surgeries.
I'm Jay, and I had my feet fixed.
I'm Chloe, and I had a spinal fusion surgery.
I'm Dawn, and this is Clayton. He had surgery on his feet. He did great. We take really good care of all of our kids, right?
Yeah!
We'll take real good care of you too. And your parents. Surgery may be tough for them too. So we're going to show you what to expect.
After this video, you can see how we take extra special care of babies and kids having a spinal fusion or hip surgery. Are you ready? Let's go.
On the morning of your surgery, you'll come through the front door and check in here at the welcome desk. That's where you'll get this cool pager. This will tell you when it's time to go to registration so your parents can fill out the paperwork. Then a volunteer will take you to the prep recovery area where you'll get ready for your surgery. This is also where you'll go right after your surgery. You'll meet the nurse who will take care of you.
My favorite thing about Shriners is that mainly they treat you like you're their own family.
Shriners is really awesome. Don't be scared.
Your nurse will have you take off your jewelry and take out any piercings, remove glasses or contacts, take off your nail polish if you didn't do that at home, and take off your socks, especially if they're stinky. Your nurse will take your temperature, measure how tall you are, and how much you weigh. And she'll take your blood pressure. This cuff just wraps around your arm and fills with air, so it feels like a big hug. Then you'll change into a hospital gown. Very fashionable. Now you're dressed for surgery. You'll have an IV put in your arm either in this room while you're awake or later in the operating room after you're asleep. An IV is just a small tube that goes in your arm. It's kind of like a little straw for your veins. You may feel a tiny pinch just for a second. If you're nervous about this, a child life specialist will help you through it. The IV stays in your arm during surgery to give you fluids or medications.
It doesn't hurt at all. It's just something like that you have to have no matter what.
I have no clue what the IV felt like because I was asleep.
It's there to help you. It's not there to be like a shot or anything.
It's just real quick, just a little pinch, and it's done before you know it.
After that, you'll meet someone on your anesthesia team. They're the people who will give you your sleep medicine when you're in the operating room. Now you're ready to go to the operating room. Your parents can't go with you, so this is where you get hugs and kisses and say, "See you later." Your parents will wait for you in the surgery waiting room, which is right next to the prep recovery room. We'll let your parents know when your surgery is finished and when they can come see you. This is the operating room where you'll have your surgery. It's very bright in here, so the surgery team can see what they're doing. It's also kind of chilly, but don't worry, we'll cover you with a nice warm blanket. You'll get a pulse ox on your finger, which tells us how much oxygen is in your blood. It just feels like someone's holding your finger. You'll also get 3 little stickers on your chest. These monitor your heart during surgery. They feel a little cool and sticky. Then your anesthesia team will give you your sleep medicine. There are 2 ways to do this. It might be a mask like this. All you have to do is breathe. We can make the mask have a yummy flavor like cherry, strawberry, oranges are other choices. Or we may give you your sleep medicine through the IV that we put in your arm earlier. It's not a shot. There's no needle. It just goes in your IV tube. The sleep medicine lets you go into a surgery sleep. A surgery sleep is different from a normal nighttime sleep. You won't feel or hear anything. You can't just wake up at any time. Your anesthesia team makes sure you only wake up when it's time for you to wake up. And he's out. You'll wake up right back here in the prep recovery room, also known as the wake-up room.
Hey there! Surgery's over.
It is? All right.
Yeah, you did great.
You won't remember your surgery, and it may feel like it was just a minute ago that you took your sleep medicine. You may not remember anything for a while, and that's normal.
My mom had told me that I kept asking if I have had my surgery yet, and she would laugh because I kept asking if I had had it.
You may be wearing an oxygen mask or have air blowing on your face through a tube. That's just to make sure you're breathing well. The best part of waking up is finding a little gift at the end of your bed. Now that you're awake, your family can come see you, 2 people at a time, and they have to be at least 14 years old. You may feel like you need to throw up, and some kids do.
Sometimes afterwards, you might feel a little nauseous, but I didn't throw up afterwards.
I did feel like a little sick in my stomach, but I did not throw up.
Or your skin may feel itchy for a while, and that's all normal.
After surgery, my neck felt really itchy and my arms were really itchy,
When I woke up, I wasn't itchy or tingly.
but it didn't hurt.
We'll give you your medicine to help your tummy and your itching. When you feel better, you can have ice chips and then some juice. We use a pain scale so you can tell your nurse how you feel. This means it doesn't hurt much, and this means it hurts more. You show us how you feel so we know what we need to do to make you feel better.
Whenever I woke up out of surgery, it hurt maybe just a little bit.
But there was presents at the end of the bed for me to keep my mind off the pain.
Then the nurses would give me a little bit of pain medication and the pain went away.
At Shriners Hospital, we do everything we can to make sure you are comfortable after surgery. We can give you pain medicine either with a pill, liquid, or through your IV. Your nurse may put ice or heat on your surgery area to make it feel better and help you get in a more comfortable position. We also have recreational therapists and child life specialists who will help you relax and provide some fun activities or games. When you're having fun, you always feel better. Depending what kind of surgery you have or how you feel afterwards, you may go home the same day, or you may stay overnight. You might feel a little weird the rest of the day, and you might not move as easily. When it's time to go home, you'll get a first-class wheelchair ride to your car. You may feel okay at the hospital, but then get sick on your way home in the car. We'll give you something for the ride home. We'll call you in a few days after your surgery to see how you're doing. Make sure to follow all of your doctor's instructions, and call us if you have any questions. Bye-bye!
We would like to thank Spirit Halloween for their generous donation. That's helped Shriners Hospital in many ways.
Like making this video possible.
If you're having a spinal surgery or hip surgery, or if your baby is having surgery, please take the time to watch these extra special care videos.